This is the science behind the symptoms, where together we will explore the new science of neuroplasticity through a lens of curiosity.
And we are a podcast of the ATNS, the Association for the Treatment of Neuroplastic Symptoms. Today we have a special guest.
We have Melissa Durbin. Welcome. We're very excited to have you here. So Melissa is going to talk about her story of the neuroplastic symptoms that she had. We're going to explore the science, and then we'll hear how the story ends. So with that, Melissa, welcome.
Thank you so much. I'm excited to be with you guys today.
Yeah, awesome. Well, yeah, go ahead and kind of just start from the beginning and tell us about the symptoms that you started having and what that looked like.
Sure. So my story started with what would be a pretty normal start. It was, I had I would say, minor back injury, and I got that during exercise. And then during my physical therapy, I actually ended up having a small tear in my meniscus. Um, so that in my knee. And then as I was kind of going through that healing process that I was on crutches, I started getting more pain in my back. So I was kind of hobbling around on crutches, had some knee pain, some lower back pain, but I felt like I was healing. It was hard to have both those injuries going on at the same time, but I was making progress. And then I had kind of a little bit of a turn in my story. And I think this is a really big part for me is I went to a doctor to take a look at my knee and kind of diagnose what was going on there. And that doctor looked at my knee and said, I think it's going to heal. I think you're going to be okay there.
Mm-hmm.
He said, but let's talk about your back. So at that point, he took some x-rays on my back, and my husband and I were in the waiting room, and he came back and he grabbed me from the waiting room and he said, you need to come see what I'm going to show you. He said, I really want you to see what's happening in your back. So,
and how long had you had symptoms at this point?
My back, I had mild to moderate pain for about 2 months. And then when I got onto the crutches, it started to get worse. I'd only been on crutches with my knee pain for maybe 2 to 3 weeks. So not very long at that point.
You said that you had an injury to your back initially, and then you also said, well, my other injury, as if you had a couple injuries. And when you think about it, do you know that you really had an injury you sustained, like you had done something, traumatic to your back? Or were you saying, well, I assumed I had an injury because I was having pain at the start, and then I was having more pain later?
Looking back on it, I really do think it started with an injury. I was actually doing yoga, doing a forward fold, and I felt kind of a pop in my back. That part did feel like an injury. It didn't feel like just ongoing pain. It was a distinct time that it happened.
That's why I never do yoga, Becca.
Power just sticks to Zumba.
That's very dangerous.
I still do yoga, you guys. I still love it. But
okay. More power to you. Go ahead.
Yes,
Sorry.
so that's okay. So then I do think that both of them were minor injuries at first, and that probably needed a regular course of healing. But then when I went to that doctor, as an orthopedic doctor, and he looked at my x-rays and said, hey, come look. And when I looked, at that point, he showed me on first the x-ray, everything that was wrong with my back, and gave me 4, I would say, felt very heavy diagnoses. And then also took out his model and showed me everything that was wrong with me at that point. So the diagnoses that he gave me at that point is he wrote them all out on a pad, like, you have spondylolisthesis, which is a whole mouthful just to say, degenerative back disease. He said I had a pars fracture. And then he said I had arthritis up my spine, which it was in a spot that I didn't even really feel pain. But kind of gave me those diagnoses and also said, just so you know, you probably should rethink your career, because as a therapist, you will be sitting long hours, and sitting is not good for this condition. And gave me this really thick, like, what is it? Like, kind of give me a brace. I would say it's kind of like a brace. He gave me a really thick brace. And then he
Mm.
said, and there's a good chance you're going to need surgery.
Oh,
Um, and yeah, I walked away from that, walked into that appointment thinking I was this healthy, vibrant young woman, walked out of the appointment feeling very broken and very fearful.
and
Yeah.
how old were you at the time? Not to ask a too personal
No, that's fine.
question.
Yeah, I think I would say I was about 35. No, a little bit older than that. So probably 37.
Hmm.
Yeah.
Wow. And were these areas that he was talking about with the spondylolisthesis and the pars fracture, as far as you knew or you remember, was that in the actual specific area where the pain was? You said the degenerative changes were in different areas, but were
Yeah.
those specifically where the pain was?
As somebody who doesn't know a lot about backs, I would say yes, it was in my lower back.
Oh,
And that's where he said the spondylolisthesis
yeah,
and the pars fracture was. And that is where I was experiencing the pain.
yeah, yeah.
So at
If
that
you were
point, it
to
made sense to me.
if
Mhm,
you were to design an experiment and you wanted to try to make someone as disabled as possible, that's exactly what you would do. You would you would take a fancy test, you would give them all these names of diagnoses,
Yep.
you would give them a brace, you would tell
Yep.
them they need to change their line of work and they might need surgery. I mean,
Yep.
this is, it's hard to comprehend how powerful a nocebo effect,
Yeah.
like this is not one nocebo effect, this is 5 nocebo effects.
Yeah.
mhm,
Hard to comprehend how powerful those words and actions were. I mean,
mhm.
it is
Yeah,
mind blowing.
right.
If you were trying to make someone disabled, that's exactly what you would do.
Yeah. And I think
Absolutely.
we always have to ask the question, how do we know what we know? So there are these abnormalities on the test. How do we know that those abnormalities are the reason for your symptoms? And I
Hmm.
think that is such an important question to really ask at all times about, I mean, everything really, but medicine and what's going on with our body. And
Hmm.
so, because there was this assumption that these changes on the test were causative or the reason for the symptoms, for the pain.
Yes. Yeah.
So continue on. So what happened after that?
Sure. So
Well, let
I
me guess,
noticed,
it got worse.
yeah, it got worse. And I noticed that before it felt like I was in pain, but I was able to live my life. I was still
Yeah.
working. I was still driving. I was still doing all those things. And then what I noticed is the pain would come, like it would become so severe. It was difficult to sit, especially
Mm.
sitting. That was where most
Mhm.
of my pain came
Oh,
from, which, yes.
interesting that he told you that sitting
Yep.
was something that you shouldn't be doing,
Yes.
right? And how far do you remember how long it took for the symptoms after this appointment? Like what the time frame was that your symptoms worsened?
It's got worse. I would say that it probably within the next couple days to a week. And
Yeah.
it wasn't like I left the appointment and they were worse. I would
Yeah.
just say that as at first it was a shell shock, right?
Yeah.
I was just shocked. And then after that,
Yeah.
what happened is it was a slow me thinking about what was happening. I started to, of course, jump on and start doing some research because I
Mhm.
knew that that information was I didn't like what I heard, it wasn't helpful, so then I'm like, "Okay, I've gotta figure this out." So I started doing research about spondylolisthesis, I
Mhm.
started trying to figure out where to go next.
Mhm.
So I'm a problem solver, and I wanted to solve the problem, right? So then I did what I knew best, and I started going to other doctors, right?
Mhm.
I'm like, "Oh, I didn't like that information. I need to find out who are the best back doctors I could go to get better information. I wanna hear something different."
Yeah.
Um, but that's not necessarily what happened. So then I really did my research and I went to a couple other doctors who had some really great credentials and were known to be really great at what they did. Um, and both of those other back doctors slash surgeons told me that I would also need a fusion at least one level of my spine and maybe two.
Hmm.
And I think that was scary enough. But then on top of that, they said, and by the way, just so you know, like ahead of time, you also will need probably the same surgery done every 10 to 15 years.
Mm,
And this surgery will cause more surgeries that are needed up the spine.
wow.
So it was this piece of not only do I have all these conditions, but now you also you're going to have surgeries for the rest of your life.
Yeah.
Right.
Right.
And the other thing I was learning is there was a lot of failed surgeries. Right.
Yeah.
And
So
and
the
they weren't
surgery itself might not even work.
it might not even work. And basically, there are no other options. Like you can try injections, which I did some research on that didn't look good.
Yeah.
And you can, and then you're probably going to need this surgery
Hmm.
um, and multiple surgeries throughout your life. And so
Yeah.
that, of course, was very scary.
Yeah.
And my pain was going up as I went through
Yeah.
this process.
Yeah.
And
And
did you get
just to remember, sorry, Howard.
oh, no, go ahead. Go ahead. Go ahead.
Just to remember, you're a young, healthy person, in your 30s and did some yoga and,
Yeah.
had an injury from
Yeah.
some yoga,
Yeah.
right? And then here you are months later on this pathway of now you're a damaged person with this debility and you need surgery. Not only do you need surgery, but you need surgery every 10 to 15 years for the rest of your life. And the surgeries might not even help. That's a huge shift.
And you
Huge.
hadn't done anything. You hadn't done anything else. You said, well, I had an injury during yoga, but after that, the things that happened that made you worse were not more injuries. They weren't that you were in a car accident. They weren't that somebody took a baseball bat to your lower spine. What
Yeah.
happened is you put on crutches. What happened is you got an MRI. What happened is multiple doctors pointed out several things making you worse. That's what happened.
Hmm.
And did you get the impression that they were basing all of their opinions on the results of the imaging testing? I mean, that's what they were continually pointing to? Or were they
Oh, yeah.
examining you and looking at your back and finding something in particular in your back? Do you see what I'm asking?
Yeah. I would say that it was mostly based on imaging. I think one of the doctors did further imaging, and then also just on my level of pain, right? So they were
Mm,
going, here's her level of
mm,
pain, here's the imaging, they have to
yeah,
be connected.
yeah,
Right.
Uh,
yeah.
and I'm to their credit, like I'm sure that they did some physical like exam, but I didn't get the impression that's what it was based off of. Um, And then the next step that I think was really helpful, that was a great step for me, is I kind of was like, "Ooh, this is not going the way I want." And at that point, I was just like resolved that I am not going to get surgery. I don't know what I'm going to do next, but I'm not going to do surgery. And so, I mean, at this point, we're 6 to 8 months in, maybe, of
Wow,
excruciating back pain
wow.
and going into COVID, my kids being home from school, so
Mm,
much happening. But I did find a pain and rehabilitation doctor who kind of said, Melissa, I agree with you. I don't think you should get surgery. I think you should just wait and
mhm,
just wait, see what happens. And he's like, I think it's going to take months for you to get out of pain, but I think that you can. And that gave me some hope. So I just stopped seeing all other doctors besides him, because I was like, this guy's given me some information that I can hold on to. The rest of them is not the way I want to go, and it's just scaring me more. Um, and then COVID hit, and when COVID hit, I feel I was already in pain. I had my kids sent home from school, and basically that I was going to be their new teacher, right? And I'm in so much pain I can barely sit up. So I was told that I will be their teacher, and I was just like, this is really scary. So then I start watching, pretty much avoid the news. As a therapist, I know to avoid the news, right? But when COVID stuff was coming up, it was like, I need to at least have some idea what was going on. And I think at that point, things felt so out of control in my life. So it added a whole nother level of
mhm,
fear when COVID hit. And then when COVID hit, I remember watching some news and watching some really scary things on the news about what was happening and not having healthcare. And because of the spot I was in, that made it a little bit scarier. Um, and so during that, I remember watching a specific news like show, like a specific few clips, a few minutes of clips where they basically said there's no access to hospitals. I mean, it was basically as scary
Mhm.
as you can get.
Yeah.
And I
Right.
remember immediately after that, I started feeling pain in my arms. Like
Mm.
it just started happening like that. It was not later. It was like, oh my gosh, I'm feeling pain.
Wow, so
Um,
that was new pain that developed in your arms
new
after
pain.
hearing the scary information about not being able to go to hospitals when during acute COVID.
Yes. And I mean, I
Interest
think if I look back at it now and I'm curious about it, I think, well, my brain was already experiencing so much fear, right?
Yeah,
I was
right.
already under so much stress, and then that
Mhm,
happened to me. And so I started having a little bit of pain. It went away, like that pain went away maybe in a day or two. And
mhm,
then just as life continued learning about symptoms, not getting better, kids home, COVID, not being able to leave the house, I noticed that I started to get pain down my right arm.
mm,
Um, and then pretty soon it was my right arm and my right leg. And then
mhm,
pretty soon it was all my limbs. But it just kind of it started to it went from a little bit of nerve pain, and it just continued to grow.
mhm.
Uh, so
And what were you thinking then? I mean, you must have really started to worry.
yeah, yeah, because I mean, I think it's like what Dr. Kennedy said. I went from 8 months ago, I'm like this vibrant, independent woman to now I have all these things that seem wrong with me. So
Mhm.
yeah, I was worried. At that point, of course, I'm still trying to figure it out because I'm not
Mhm.
getting. I don't feel like I'm getting any help or guidance, or the guidance I'm getting just makes it feel scarier.
Yeah.
So I went to a doctor that I felt was I that I felt would be a good option for me at that point, and she was so sweet, but she said, "I really think that you need to rule out. I think we need to do some brain imaging, and rule out some autoimmune disorders." And so then I specifically said, "Which autoimmune disorders?" And so she said, "I think we need to rule out MS,
Mhm.
um,
So multiple sclerosis.
multiple sclerosis."
Mhm,
Yep. And then at that point, she sent me to a neurologist.
mm,
Um, so I think in a year, if I remember right, I was on like 3 or 4 scans of my body. Um, and the neurologist kind of looked at all my symptoms. And at that point, it was, yes, I had pain down my limbs, still having the back pain, but I also was experiencing some other kind of abnormal or strange symptoms for me.
mhm,
Um, just little things like, I mean, now that I look back at it, I'm like brain fog, right?
mhm.
Probably due to stress, but at that time it
Yep,
goes very
yep.
well with MS or multiple sclerosis.
Mhm.
Um,
And I wanna just stop you for 1 minute, is that when the way that our brain functions is that when our brain is perceiving danger, the danger part of our brain gets dialed up and the prefrontal cortex or the thinking part of our brain gets dialed down. So it's
yep.
just a normal way that the activity of our brain functions when our brain is perceiving stress. So that brain fog is a part of the activity of our brain.
And it's pretty common, obviously, for the brain to create new symptoms
Mhm.
when there's an increased level of threat or danger. And you had,
Mhm.
some level of danger and fear going into COVID, but COVID took it to a really high level, obviously.
Yeah.
And, you were of the opinion, well, I'm not going to worry too much about my back pain. It's there, but I'm not going to worry too much about it. The doctor said it'll probably get better. There's hope there. And, what I always often say is that, if you're trying to get somebody's attention and they don't hear you, you speak louder.
Yeah.
And then with the COVID, the brain's danger signal got to a higher level and started speaking louder. And this louder speaking was new symptoms that were probably even more scary.
Yes. And I
Mhm.
will add to that, although I would like to say that the doctor's saying, my back will probably get better. I would like to say my brain felt safe, but my brain still didn't feel safe because the pain was so high that
Yeah.
even though I was trying to believe that and I was really working hard to believe it, there was definitely still fear there.
Yeah.
Just because it was so high. So I went to that neurologist and he said, you definitely have some of the symptoms of multiple sclerosis, but you don't have all of them.
Mm.
And so he said, I really don't believe you have multiple sclerosis. And that was great news. But when you have your body having so many symptoms, it's really
Mhm.
hard to believe that. So I think I believed that 70%.
Mm.
um,
Did he
and then
examine you? Did he do a neurologic exam,
he,
checking the reflexes and the muscle strength, and was that all
yes,
normal?
yes, he did do that. And that was what he really deemed as like, you don't have multiple sclerosis because you still have strength. And if you did, you would have lost strength. So I
Right.
had a lot of the pain symptoms that were very congruent with multiple sclerosis, but not the other neurological symptoms.
Mhm.
Yeah. Um, and then from there, I'm trying to think of what happened after that. Oh, so I just kind of decided that I'm not going to do anything more medical.
Mm.
And I started researching because I had heard little tiny pieces out of all the doctors I had went to. I had never heard anything about the science of the brain, pain
Mhm.
reprocessing therapy. I had not heard that directly, but I had heard just little tidbits enough to know that something was not lining up.
Mm.
Um, and so I just decided no more doctors. I'm going to start researching on my own, which I was doing before, but I was doing it under the guidance of doctors. And I just decided I'm going to take a break from all of that because it's causing more fear.
Mm.
And then I'm going to I was essentially not able to get off my couch for a
Yeah.
couple of months. So during that time, I just thought, you know what, I'm going to start looking at other studies and other research um, and see if I can figure out a way out of this. And so
Mhm.
I came across some stuff by Laura Mar Mosley, stuff by Dr. Schubiner, Alan Gordon. I mean, just a ton of people who are putting out some great science. And I started reading it, and it was just like this light for me where I was like, oh my gosh, I've been getting so much scary news, being
Mhm.
told that I'm broken, I'll never get better. I mean, just so many things. And I was like, there's a science out here. Like there is all this information that is building upon each other and it's
Mhm.
really legitimate good science.
Mhm.
I've got a pretty good science background. And when I was looking at it, I just thought, why has nobody told me this? Um, to be quite honest, I got kind of pissed. um,
Understandable.
yeah, so I started reading, and then I decided that I'm just going to spend 2 to 3 months looking at all of that
Mhm.
before I would even consider seeing another doctor.
Mhm.
Um, at that point, I just started listening every single day to anything I could that would help my brain to feel safe, right?
Yeah.
So everything that you guys put out, Curable, um, the book by Alan Gordon, I made sure that every day that was part of my
Yeah.
process.
Mhm.
Somatic tracking,
Mhm.
everything to kind of calm that fear.
What
Mhm.
what
I s
what was it that made you kind of have that buy-in or belief that this fit you? You know,
Mm,
you recall what was there certain information or certain
yeah,
things that occurred in your, in your life or your body that kind of, crystallized for you or gave you that moment where this made more sense to you than what the doctors had told you?
absolutely. So for me, there were 2 things early on. First, it was, I watched a video by Laura Mar Mosley, and I was like, "Whew, that's that makes sense to me. It would make so much more sense than, anything else I'm being told." And then I started reading The Way Out.
Mhm.
And so
Uh,
Lorimer Mosley's video describes that all pain is made in the brain by neural circuits as a warning signal because of how the brain is interpreting the signals that come in, rather than pain being made out in the body by the nerves because of tissue damage. Is that essentially the message that you got from
Yep.
it?
Yep. And then I think also The Way Out gave me a different level of hope.
So The
And
Way
it
Out,
was
the book by Alan Gordon.
the book by Alan Gordon.
Yeah.
And then what happened was within 2 or 3 days, my pain went down.
Sure.
And so I didn't really, not that it was gone. I definitely still had work to do, but I was like,
Yeah.
yeah, that doesn't make any sense unless I consider the science and
Yeah.
I'm looking at it from a different lens than I had been looking at it
Yeah.
from before.
And was it the arm and legs pain that went down, or the back, or everything? What
Yeah.
do you recall?
I think the arm, actually, I know the arm and leg pain went down first. That was the easiest for me to kind of get rid of. The back pain definitely took longer.
Mm-hmm.
That was the hardest for me to get rid of, and I had to work. I would say it took me about 2 months to really fully, I'm gonna say, get rid of all of my pain. Um, and then there were certain activities that definitely would keep that pain turned on, and sitting was one of them, interestingly, right?
Yeah.
Um,
And why do you think that it was harder to get rid of the back pain? And, there's going to be lots of different reasons, but
yeah,
like, do you think having seen the imaging results and being told that there's changes in there, because
yeah,
it sounds like you hadn't been told that there was any changes for your arm and leg pain, so there wasn't sort of planted in your brain this destruction or, this change in your body.
yeah. I think it was truly the level of fear I had around my back. And once I saw those images, I mean, I don't know how anybody couldn't when you're brought these images and said, "Look, you have
Yeah.
all of these things wrong with your back."
Yeah.
Um, that was the first diagnosis I got, and there was so much fear with it because for
Yeah.
me, it was life altering. Like you can't. I mean, maybe you can fix it with multiple surgeries, maybe, but it was like, and you can't be a therapist. Oh, and
Yeah.
by the way, it's going to change your exercise, and I
Yeah.
love to exercise. So
Yeah.
I think that diagnosis, and it also made me feel disabled. I mean, it made me feel like I was broken.
Yeah.
And I think really working through that was very tricky.
Mhm.
Um, and also, I had been told by 3 medical professionals who had very high, I mean, great education, that this was what was wrong with me.
Mhm.
So I had some work to do to really unravel that. Um, and I think that was why it was so important for me to almost every day, I'd say almost every day or every day, I was listening to the science. And I'm
Mhm.
like, I have to gain a new understanding of what's going on with my body because I'd basically been told I was broken and
Mhm.
not beyond repair, but the repair didn't look good. Like,
Mhm.
it
Yeah.
was so I do think that was what was going on, is it was very hard for me to undo that belief.
Mhm.
Did they tell you anything else aside from the sitting being dangerous? Did they say, "Oh, you have to watch your posture, you have to
Oh, yeah.
develop your core strength," or
Oh, yeah.
did they talked about you got those messages as well somewhere along the way?
Yeah. Yeah, I got a lot of those messages. I mean, I was told, like, my legs are a different height, so that
Mhm.
might have to do with it. Yes, I need to develop my core strength. Yes, um I mean, I just was told so many different reasons. I was told I had an annular tear later,
Mhm.
which to me kind of made more sense. Like, okay, I had this initial injury. I had
Uh-huh.
a tear. It healed. And if
Mhm.
if I wouldn't have been told all those other diagnoses, my guess is, like, if I was being, like, curious about it, my guess is that I had this injury that would have healed and I would have been okay.
Mhm.
Um, so, um, yeah.
Yeah. And there is, again, it's getting back to that question is how do we know what we know? So there's lots of different information out there that your core isn't strong enough, you're asymmetrical, one leg is longer than the other, you're sitting too much, it's your posture, all of these different things. that are told to people or attributed. But again, how do people know what they know? And whether it's someone at a well-known institution or the internet or your mother, it's how do you know what you know?
Mhm.
And 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 I think often we assume that if those sort of messages are told to us by a clinician or a professional, that they're objectively true.
Mhm.
But it's again really looking at the research, and there is not research that shows these sort of things, that it's posture or that it's asymmetry. Lots of people have bad posture with no pain.
Sure.
Pretty much everybody is asymmetrical to some degree. And most people, they don't have pain. So, but once we hear these things, it can be difficult to let go of them.
There are good research, really good research showing that these things are not causative of back pain. And, it's like Becca says, well, we know things because we just assume them. Everybody knows. All PTs are taught all these concepts about posture and core strength and sitting. Doctors pick that or taught that as well, but the actual studies show that they're not correlated. And there's
Mhm.
several studies that show that. Um, and so it's interesting that a lot of these things you would think research would filter down to the schools, to the doctors, to these highly trained, smart people, physical therapists and doctors. And yet they continue to, keep telling people these same things that are inaccurate.
Mhm.
It's sad. And it was interesting that you said I just said it was sad, but you said it was frustrating or made you angry, right?
Yeah, oh yeah, I was angry, and I think the other thing that kind of goes off what you guys were saying is that I was told so many things I couldn't do for the rest of my life.
Mm.
Hmm.
Um, and honestly, if I look back at that, it does piss me off because I'm doing all of those things and I have no pain.
Yeah.
Yeah.
Um, and so
So
I do,
now, at this
yeah,
point, you're doing all of those things and you don't have pain.
yep, I'm doing them all. So all the things that I was told I shouldn't do yoga, I shouldn't run. I went on a 2-mile run with my daughter this morning. I shouldn't I mean, just certain positions back. I shouldn't sit. I shouldn't be a therapist because I shouldn't sit for long hours. I mean, so many things I was told I should never do again. And actually, I went to a doctor for something minor. I had like a hip, like something from like over exercise. Like my hip was just like, I probably need to stretch it. So I went to a doctor the other day, and this was a tiny thing, but it's been happening for a while. So I should check. And as I let, because I don't often check anymore, I just think, "Oh, my body will be okay." I feel really strong now. And he said, I mentioned something. He asked me how my back is doing. And I said, "Oh, I'm doing amazing." And I told him a little bit about pain reprocessing and what I went through. And in that, I said, "Oh, yeah, I was out kneeboarding last weekend." And I gave him kind of a list. And he goes, "Oh, you should check with your physical therapist. I don't think you should be doing those things." And at that point, I just said to him, I was like, "No, I know that my body's safe and I am okay to do those things." But it is that
Yeah.
again, like still I'm 4 years out from having pain. I'm doing all those things and I still got that message of like, "Oh, you better be careful. You might not be
Yeah.
okay." And I'm just like,
Yeah.
"Yes, I absolutely." I mean, I'm lifting, I wouldn't say heavy, I would say moderately heavy weights at the gym. I'm doing great, right? And so that, yeah, it is frustrating, um,
Okay.
because I also see it all around me. It's happening to people I love, it's happening to my clients,
Yeah.
so yeah, it's hard. It's hard.
Yeah.
You brought up, we were talking a little bit about emotions, frustration,
Yeah,
being pissed off, etc. When you look back at it, at the time that you initially had the initial back pain episode and then the increasing when you were on crutches,
yeah.
was there things going on in your life at that time that, in retrospect, might have been additive or triggering of the danger signal in your brain?
Sure. You know, I don't know if there were big things. I think that there were, yes, hard things happening in the family I grew up in. Um, and I did grow up in a family that we didn't really express a lot of our negative
Mm.
emotions. And
Mhm.
so, um, do I know if that was part of the story or not? I don't. I have gotten so much better about expressing my emotions and feeling okay with being angry. During that process, when I was laying on my couch for months on end, I would did the writing to try and release anger and emotions. So, but during that time, there were some things happening, but I don't think it didn't feel like it was the trigger.
Hmm. Did
Yeah,
you?
I
So,
noticed that. It was just interesting. One of the classic things that therapists look for is how emotion is expressed. And when you first said that really pissed me off, you had a big smile on your face, and it was interesting to see that, and then when you said that your family didn't typically express emotions, it
Yeah.
kind of fit in with that
Yeah.
model where people tend to, if they're upset or frustrated or sad or angry or whatever, it kind of gets shoved down. And
Oh
I
yeah.
just wonder if that's something that kind of came out of this as a benefit for you, as you learned the relationship between emotions and pain or not.
I would say, I mean, I think this is a really hard thing to say to anybody who's in pain. Um, and it's one of those things you have to say kind of carefully, but I feel like the lessons I learned going through that whole pain journey have m- made my life so much better, right? Like it's been with expressing emotion, just like you just live differently after an experience like that. Um, but yeah, it was hard, and I do think learning to express emotion and be more okay with it and just validate your own feelings. That was definitely one of the lessons I learned through it.
Was
yeah.
asking for what you need or being authentic in your communications, did that those kind of things come up for you as part of this process?
Yeah. Yeah, I was thinking about like what are my takeaways? What are the things I think about more now? And that's a question I try and ask myself. I wouldn't say every day, but if I'm feeling stressed or overwhelmed or anything, angry, I'll ask myself, how am I feeling? What
Hmm.
do I need?
Yeah.
And then try and show up for myself instead of just pushing my needs aside,
Hmm.
and showing up for everybody around me. So
Hmm.
it's been a little bit of a gift. That's for sure.
Amazing. And it
Hmm.
is it is remarkable, and people talk about that a lot. That's my own experience as well. Is that often it's the patterns that are not serving us that set the
Hmm.
stage for then our brain to become hypervigilant, overprotective, that then creates the symptoms, these chronic symptoms that get stuck in place. And so learning to get to the root of the patterns that weren't helping us can get us to a place that's better than we've ever been. And it can be a hard message to hear if you're, in the middle of it.
Yeah.
As a therapist, so it sounds like a lot of what you did learn, or some of what you learned at least, that was helpful was feeling and expressing emotions
Hmm.
in your training you're a mental health therapist.
Hmm.
Yeah.
Yep.
Is that something that you learned in your training as a mental health therapist? Or
You
is
know,
it different, would you say?
yeah, so I actually started as a school psychologist and
Mhm,
then became a mental health therapist. And yes, I think that you do learn some of that. I think most of what you learn when you're in school is more cognitive behavior therapy,
mhm,
right? And knowing more about your thoughts and behaviors. But what I found through this process that I really grew in and I knew I needed, and then I also see it all around me,
mhm,
is really knowing how to take care of yourself, right? Setting
mhm.
appropriate boundaries, listening to your emotions, listening
Yeah.
to like what your brain and nervous system is saying, and then responding to that. So
Mhm.
I I think that I had a lot of tools as a therapist before,
Yeah.
and now, I mean, a lot, but not enough, right? And now I'm
Yeah.
like, oh my goodness, there's this whole other set of tools, especially the emotions, the
Mhm.
somatic work. all the nervous system regulation or keeping our brain safe.
Mhm.
All of those are tools that now I think just living in the society and the level of stress we have now,
Mhm.
we have got to implement these tools in order to just feel okay.
Mhm.
Um,
Yeah. It'd be great for you to go back to the school psychologist and teach these things to the high school students.
yeah. Yes. Yeah. Well, I have to tell you guys, I got to go back. So that one doctor who was just like, I have hope. Like, I
No.
think it'll be okay.
Yes.
He asked me to come back to his hospital and do a
Yeah.
training. And, it's so awesome when it was like, at least I feel like my story can impact others,
Yeah.
right? Of wanting to learn this information.
Yeah.
Uh,
Amazing.
And to pick up on another thread, you got worse when COVID hit. And obviously, COVID was a time of extreme stress for
yes.
everybody and in the society and for you and your family, of course. But in addition, it seemed like that was a perfect storm, which in a sense forced you to be doing everything for everyone else.
Yeah. And
And
when
so in
the
terms of neglecting yourself and your own needs, that seemed like that probably made that a lot worse. Does that make sense to you?
Yeah, I mean, the kiddos were home every single day I was supposed to be teaching them, right? And so but it was tricky because I couldn't actually meet their needs during that time either because I was in so much pain.
Mhm.
Um, it yes, it was definitely the perfect storm.
Mhm. And what were so, in getting better from this, what
Yeah,
would you say are the highlights of how you articulate what, how you were able to get better?
sure. I know for me, the first piece of getting better was just having the realization that I wasn't broken,
Yeah.
right? I mean,
So the science.
yep, I'm
Mhm.
hearing the science and
Yeah.
then knowing, oh my gosh, this is not a life sentence. I am not
Mhm.
permanently disabled. I can get better and having hope again
Yeah.
because you're looking for that all along the journey, right? And it gets
Sure.
crushed and crushed and crushed.
Mhm.
So the science and reading the studies, I went back and read the study. Of course, I was reading the books and watching online, but I was like, I want to see the studies.
Mhm.
That gave me a lot of hope. So reading the research was huge. I think just listening to it consistently. I did have a coach. I didn't really use them very much because I felt like I had done a lot of the work. But man, having somebody there to say, "Yeah, you're on the right track," was
Yeah.
amazing. Um, and then I just really worked on taking care of myself. I decided that this period of my life, I just really need to focus on my own healing. And if it wasn't focused on my own healing and just kind of keeping my brain safe and lowering my nervous system, if it wasn't focused on that, it was just a no. So I also learned
Mhm.
great boundaries during that time.
That
Um,
is amazing. I love that. I think the empowerment of this work can be so fantastic.
yes. Yeah. And they're all
So
things that now I'm like, I learned, somebody said to me along the journey of pain is an amazing teacher.
Yeah.
Right? And so it's like you can't ignore it. It will teach
Yeah.
you. And
Right.
so it
Mhm.
really did kind of force me into a place where I had to say no to so many things and I had to set
Yeah.
really good boundaries just so I could
Mhm.
have that healing.
Yeah.
And
Right.
I haven't lost that, right? Once you've learned it,
Yeah. Amazing.
um,
and how did
and
you decide that doing things for yourself wasn't selfish?
ooh,
How
that's
did how
so
did you
good.
how did you reconcile that and wrestle with that? Because so many people feel selfish when they
Yeah.
do things for themselves.
Howard, that is one of my favorite things to talk about. I am so glad you asked me that question. Because here's the thing, here's what happens, right? Is if I don't take care of myself, I cannot take care of anybody else, right? I cannot be the person I want to be, the mom, the wife, the therapist. I cannot show up for
Mhm.
anybody else if I'm not taking care of myself. So that was the first piece that like really that made it okay for me to take care of myself. And then through the process, I also got this, and I deserve to take care of myself, right?
Mhm,
Like,
mhm.
oh,
Yeah.
I deserve to also have an amazing life. Like,
Yeah. Right.
especially after going through something like that,
Yeah.
right? Of like, I want to have a life that I love. So yeah.
And
Same.
did you, and again, looking back on it now, do you think that maybe you weren't given that impression when you were younger growing up that you
Oh,
didn't?
absolutely. Absolutely. Yeah, I think I came from a generation of women that were taught, and it's not, I think the intention is good, right? The intention is I want to take care of everybody else. That makes me a good mom. It makes me a good human. Um, but it's devastating. I think, especially for us as, I mean, for me, I think like I look at the women around me,
Hmm.
my
Yeah.
clients, everybody I'm working with, and they are killing themselves
Yeah.
trying to take care of everybody else. And they're exhausted, they're fried, they're
Hmm.
overwhelmed,
Yeah.
and and they feel selfish for taking care of themselves.
Yeah.
But yeah,
Right.
that was definitely I definitely had that message growing up. And I remember even having a hard time saying to my mom or other family members, like, I'm gonna go to yoga today. I'm gonna leave my family. I'm gonna go to
Yep.
yoga because I need to take care of me. And I'd be like, "Ooh, that
Yeah.
sounds so bad." And I'm like, "Nope, it's good."
Yeah. Amazing. And I was curious that when COVID came and that it was your responsibility to teach the kids. And just
Yeah.
curious, there's maybe, very clear logistics, but
Yeah.
it struck me, it sounds like you're married.
Yeah.
And was it just assumed that you were the one to teach the kids and not your partner?
Yeah, that's such a good question. And I'm probably an anomaly in this. I have an amazingly supportive husband. Um, but he's in law enforcement. And during COVID, you can imagine what that looked like, right? So he wasn't
Yeah.
available. I mean, he was
Mm.
available as much as he could,
Yeah.
uh, but he was not able to get time off very much. And
Yeah.
he had to do all the stuff police officers and law enforcement were doing.
Mhm.
Um, and I ultimately actually made a decision to have my kids go into private school,
Mm.
and I'm so fortunate that we could do that, but
Yeah.
because I couldn't even at that point, I could barely sit up to teach them,
Yeah.
right?
Right.
And it
Right.
was just such a mess, but it did take some time to get them into a school,
Mhm.
um, so that time was very
Yeah.
tricky.
Yeah. And it's
Yeah,
interesting. I mean, I have an amazingly supportive husband as well. He's probably consider himself a feminist. He's an engineer and worked in the business industry, and it was so male dominated that just the culture of it the responsibility for the kids in general fell on me, even
oh,
though
yeah.
I'm a physician, right? And so when they're in elementary school, I'm the one that's filling out the forms, and it's just this sort of cultural idea that that's just sort of the default.
Mhm,
And I think often even in very supportive
mhm,
people, I mean, I do see it changing, at least where I am, for sure.
yeah,
But I think there's just so much of the responsibility that comes onto the shoulders of women.
And
yeah,
studies have shown that, studies have shown that women in relationships with men, married relationships, do most of the work at home. It's not
yeah,
just childcare, it's the cleaning, it's the, taking care of the house, it's arranging for things to be
mhm,
fixed,
mhm,
it's
Yeah.
just everything. And and nobody, nobody seems to think too much of it.
mhm.
Hmm. Yeah.
I would love to add to that because I, of course, see that same dynamic, and I work mostly with women. But then there's all the guilt and shame as women that we feel for not being able to do it all
Yeah.
perfectly well.
Yeah. Right.
But we can't express those negative emotions, right? I
Mhm.
mean, that's yeah,
Yeah.
it's another
Yeah. Yes. Right. And I think all of that is a lot of what really ends up that the numbers of women or the numbers of people with chronic pain is
Mhm.
more often middle-aged women.
Yeah,
Yeah, it's a
it's a
tough
hard
time in
time.
life. Awesome.
Should we turn to the science?
Yeah, 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 yes.
Well, we're talking. This is science. I mean,
I know, we're including
this
it,
is
but
the science of you
yeah.
know of of how these disorders occur. But I think there's just and we alluded to it a bit before, but it's just so many examples of how the medical profession is so myopic, so wrong when it comes to back pain. I can't think of another disorder in which modern medicine is so inaccurate. Because if you look at the data, and your doctors should know this, these data have been available for 20 to 30 years. So you were in your 30s, mid 30s when you had back pain, and that's when they did their MRI. So people in their 30s who have no pain and are healthy, 52% of them have degenerative disc disease. Half of the people that age who have no pain at all have degenerative disc disease. So how can we say that degenerative disc disease is the cause by default, by definition, 100% the cause of pain when millions and millions of people have it with no pain at all? How about disc bulging? 40% of people in their 30s have disc bulging with no pain. How about annular fissures? 22% of people at that age have those with no pain at all. How about spondylolisthesis? It's only 5%, but still 5% of people at that age have it, and all with no pain. And all those numbers jump up dramatically when people hit their 40s, 50s, 60s, and 70s, and then they become universal, which means that all people in their 50s, 60s, and 70s have these changes without pain. And yet, this is the main way that we're using to tell people that they're damaged, they're broken, they need surgery. Not only one surgery, they're going to need multiple surgeries.
Mm-hmm.
They should change their career. They should never be active and enjoy their life exercise-wise. I mean, it's hard to have adjectives that are tactful and, to describe this, because the only adjectives that come to my mind are
it's a family show,
so
Howard.
strong that people would get mad at me if I said them.
And again, to reiterate, I mean, what Howard you're saying of the studies is that, one of the studies was 3,000 people with zero back pain, and they did MRIs of all of their backs. And this is some of the data that Howard is describing. So people with no back pain and their MRIs of their backs, and people in their 30s having degenerative changes, and that progressively increases so that by the time people are in their 80s, nearly 100% of people have degenerative arthritis changes in their back. The spondylolisthesis, some of it is, smaller amount, but disc bulges, stenosis, the bone spurs. And again, all of those changes, and it sounds really scary, but those are normal age-related changes. And again, it's not to say that none of the changes cause any symptoms. So if someone has a huge disc bulge, and you can see on MRI that it is very specifically pressing on a nerve, and the area of their pain is in that very same distribution, and it's consistent, then yes, that can be the reason for the pain, for sure. Those disc bulges sometimes get better actually on their own without surgery even. So again, it's really looking at all of the information and putting it together and how it makes sense.
There was a study done in Britain where they took MRIs of people and they randomized them into two groups. One group was given the exact same diagnoses that you were given, Melissa. They were told, this is what your spine looks like. It's got spondylolisthesis, it's got degenerative disc disease, it's got disc bulging, it's got arthritis. They were told that, just what it said. And the other group, they were randomized to tell them, these are the findings on your MRI. And we know that these findings are often seen in normal people. That was the only difference. And when they followed both of those groups 6 weeks later, the people who had been given the diagnoses without any provisos were worse. They were more likely to have injections. They ended up more likely to have higher pain and more often to have other invasive procedures. Whereas the people who were given just the simple truth, that these findings are also commonly seen in healthy people tended to be better. They had less pain. They were less likely to get injections. They were less likely to have other invasive procedures. Just that simple truth that we all should know. All doctors should know that. This chart that Becca and I referred to, that we're talking about from this one major study, should be on the wall of every doctor in the country.
Yeah. And, a few years ago, I think there was a law that was passed that patients had access to their test results immediately, right? Seems like a great idea. Absolutely. Patients should have access to their medical records, their medical information. Absolutely. But what are the unintended consequences? I mean, the test results are really intended for a physician, for a clinician. They're not intended for patients. And if you don't have the context and the understanding to know how to interpret those, then it can incite so much fear and worry. And then people going on the internet to understand them. And then they read about, lots of scary things. And then and as we've seen, information can really increase the fear in our brain that can then affect our experience. And so I think it's a really important point is to understand that the test results don't necessarily just mean something in the body. It's really the whole context that's important.
Yeah, I mean, and when we think about those changes in the spine, it's more accurate to think of them as like getting gray hair, graying of the spine, or getting wrinkles. None of you have that problem, but some of us do. But getting wrinkles in the skin is a normal sign of aging. Wrinkles don't hurt. Gray hair doesn't hurt unless you look in the mirror too often. But the point is that if you go to a doctor and they tell you you have facial pain or head pain, and they say you need a facelift or you need to dye your hair, I mean, how absurd is that? But that's exactly what's happening in this world of back pain because of those test results. And the other thing that may not be, oh, go ahead, Melissa.
I just think about how different my story or that whole year of my life or year and a half would be if that first message was given to me differently, right? How important that is. So
Absolutely.
Yeah.
Hmm.
The other kind of related topic has to do with the MS, the multiple sclerosis, where they were ruling that out. And it was a good thing the neurologist examined you and told you that your neurologic exam was normal. But a lot of times, same thing can happen on test results with that, where people have an MRI of their brain and they have these white spots or white lesions in the brain. And if you interpret those white lesions as being MS lesions, which MS can cause that, you could easily scare people to death by saying you have MS or we think you might have MS, or you're going to develop MS or something like that, that can sit as a cloud over somebody, a sword dangling over their head, making them worry day in and day out about getting a horrible neurologic disease. And many normal people have white spots in their brain with no problems due to them.
Yeah, and many, 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 many patients have been assessed for MS when they have neuroplastic symptoms because the symptoms can be in all these different areas and they can come and go, and they can't explain them otherwise. And so many, 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 many people end up having a brain MRI or having assessment to see if it's multiple sclerosis. And so that's very common and normal for people to be assessed where doctors are wondering if maybe this is multiple sclerosis because of the pattern and otherwise not being able to understand it. And it turns out that it's not, but there's a lot of fear that can be, like Howard is saying, that can be instilled in someone if they're even be evaluated for that or told that maybe it could be. And I've had patients that actually had normal MRIs with no white spots. And then they were told, well, you could develop multiple sclerosis. And now that fear is in them and they carry that with them. And well, yeah, you can develop anything. I mean, but it doesn't explain the symptoms at the time, and that's not the reason for the symptoms, and you're not gonna then develop the reason later for the symptoms you're having now. It's still not because of multiple sclerosis. And so, again, that so much fear can be instilled.
Yeah, the power of the word. And Marcel Proust said, like about over 100 years ago, that doctors can inculcate disease that's 1,000 times more potent than any virus. The idea that someone is ill, how
Mm,
powerful that can be.
yeah.
That definitely feels true.
And that's it's exactly what happened to you, Melissa. It's exactly what happened to you. As I said at the beginning, I said two things. One, that's why I don't do yoga, but more importantly, what I said was that if they were trying to make you worse, they couldn't
Mhm.
have done a better job with faulty and inaccurate information. It's just so crazy, just so weird that this is still going on after all these years.
Yeah.
Yeah, I'm so thankful to be able I mean, I honestly, when I look back at it, I'm like, wow, I am so thankful and fortunate to have found this information as early as I did, right? I was in pain
Yeah.
for a
Right.
year, 18 months, and it was
Yeah.
severe. It's a year to
Yeah.
18 months. And I think
Yeah.
about how many people are living with severe chronic pain
Yeah.
and either have been told so much stuff that they won't even be open to this, or they don't
Yeah.
get the information.
Yeah.
Right? And so I
Yeah.
just feel so fortunate to have had that information early on
hmm
to get out of that fear cycle.
Yeah.
Um
Absolutely. Yeah. And, to be fair, also, as a primary care doctor, and I didn't know about this information before
Mhm.
I came upon it. And I used to tell people that it was these changes in their spine. And I mean, I don't know that I ever told someone to change their career, um, and the thing is as physicians, you want to help people. You want to find
Mhm.
answers. And if there aren't answers, I think it's, people are coming to you, asking you. I think it's a difficult thing. And when that's what the whole industry believes and is saying, it's hard to figure something else out. But little
Sure.
by little, hopefully getting more of the science out to help
It's
people.
it's funny that we think that science changes by research, and we've been doing as much research as we can, obviously, showing that in several studies that back pain can be reversed by doing pain reprocessing therapy and by doing emotional awareness and intention and expression therapy.
Mhm.
Um, but it's what's interesting about this work is that people often, when they hear about it, they often think that, well, it's too good to be true. Something so straightforward couldn't possibly have such powerful effects,
Mhm.
and therefore it's often discounted
Mhm.
unless it happens to you.
Mhm.
Mhm.
And it's striking how many of the people who understand this work and get this work and do this work are the very people who actually had the conditions themselves so that they could see it in real life for themselves. And seeing is believing because, that's what happened to them. It certainly made a believer out of you, I'm sure.
Oh, yeah. And once you know this information, I mean, I think about the people I know who are in this field. They are some of the most passionate practitioners I know,
Yeah.
right? Because once they have felt it and experienced it and watched so many lives change, it's like we want to get this out to everybody, which is really cool to see the level of passion and just giving of information from people in this field,
Yeah.
right?
Yeah.
But yeah, you're right. Once you have felt that in your body and you've seen it at work, you can't undo that information.
Yeah.
Uh,
Absolutely.
Well,
And
it's a good thing that we expect this podcast to have millions of views. So that'll help.
yeah, exactly. Hopefully. Well, thanks so much, Melissa, for joining us. Really, really lovely to hear your story and have you share it. And the most lovely part of all is that how well you're doing now. So
mm,
really appreciate that.
yeah. Thank you.
Thanks, Melissa.
Thank you guys for having me here.